An elective caesarean section is one that's planned in advance. The decision to have a caesarean section is made between the patient and the obstetricians. Once we are given a list of ladies who are going to have elective caesarean sections, we then invite them to come and see us in the anaesthetic clinic within a week of the date of their caesarean section. We will give you two types of tablets. One's an anti-acid tablet, one's an anti-sickness tablet, and we'll ask you to take one the night before you're coming in for your caesarean and both tablets in the morning of your caesarean section. That just reduces the risk of you feeling sick during the operation and makes it less likely that we'll have problems with you having acid in your tummy. Our standard anaesthetic for an elective caesarean section is what we call a combined spinal and epidural anaesthetic, and that's both a spinal anaesthetic and an epidural. When you come in, you'll be directed to one of our rooms, our assessment rooms on delivery suite, and then you'll be visited by a variety of people. This will include the anaesthetist that will be looking after you on the day. The surgeons, the obstetricians will come and see you and go through their consent form for the operation with you. The midwives will come in and have a listen to your baby, and some of the theatre staff will come and make sure that you have the gown and that you're all ready to go. The first thing that we always have to do before an anaesthetic is put in a drip or a cannula into one of the veins, usually in the hand or the arm. This is a safety thing, so if there's any problems from the anaesthetic, that we can give fluids and drugs and medicines down into that drip quickly. Anaesthetists will dress up almost like the surgeons do for the operation, and they clean the back with something that's really quite cold, makes people jump. And that's just to reduce the risk of introducing any infection into the injection site in the back. To do the spinal and epidural injections, we have to get the lady usually to sit on the edge of the bed, and they have to bend forward slightly and curl up. We say a bit like an angry cat, or if you're carrying heavy shopping, and what this does, it just opens up the spaces between the bones in the back. We put some local anaesthetic into the skin of the back. Now that does sting a little bit when it first goes in, and we then put some further into the back, but then makes the area nice and numb for having the injection done afterwards.
I remember some really cold solution going on my back, and they said that was just to clean the area, and then I think the stingy bit may have been the local anaesthetic just to numb that area.
When the injection's being done, it shouldn't be painful. You should be able to feel a pushing or maybe a slight aching feeling in the back, and if you feel any other pains, you should tell the anaesthetist that's doing your anaesthetic. The spinal anaesthetic is just an injection which is then removed. The epidural is a really fine small tube which is then left in the back. There's nothing sharp left in, it's just a small plastic tube. We then, once the injection's in, we get the ladies to lie down quite quickly. That's because the local anaesthetic works with gravity. The ladies start to feel some warmness in the bottom, tingling pins and needles in the legs, and then their legs feel really heavy and difficult to move around. While the numbness is coming on, which usually takes up to about 10 minutes, we also have to put a catheter, which is a small tube, into the lady's bladder, because the bladder is very close to where the operation is taking place and we want to empty and out of the way. There's always a small risk that the anaesthetic won't make you numb enough for the surgeons to start the operation. You check the block very thoroughly. We do this using a freezing cold spray.
The anaesthetist, she tested the anaesthetic with some cold spray, she said it was. She tested it first up here on my near my collarbone, and it was really cold, and then she said she was spraying it up both sides of my legs and up onto my tummy, and I couldn't feel any of that at all. It was quite strange, but reassuring.
If for some reason that numbness isn't good enough, we then have some other options to go through, which might involve another injection or an epidural, and we always have the backup option of a general anaesthetic if we really need to. When the injection's done and the numbness is coming on from both an epidural and a spinal anaesthetic, it is normal for your blood pressure to drop. We keep a really close eye on the blood pressure in theatre, and you have a blood pressure cuff that will inflate and deflate on your arm every minute. But sometimes people's blood pressure drops quicker than other times, and if you feel dizzy or sick at any point, it's probably because of your blood pressure. We have lots of medicines that we can give into the drip to help the blood pressure back up.
It might drop my blood pressure, but there was some medication that they could give to increase my blood pressure. Might feel a bit dizzy, But long term, very, very rare that anything long term would come of it with regard to moving my legs or anything like that.
Other risks are generally very rare, and that's why we choose this kind of anaesthetic as our first choice. And they include things like a severe headache and a very small risk of damage to the nerves themselves. It's most likely to be a patch of numbness on the leg, somewhere that would go away on its own over a few weeks to months. That happens to about 1 in 10 to 15,000 people. The risk of it being a more severe or permanent weakness and numbness of the legs is incredibly rare, in the region of 1 in 100,000. Once we're happy that the anaesthetic is working and that the catheter's in, we then get the birthing partners to come in. They have to wear a hat and a gown, and they come and sit up at the head end with you and with your anaesthetist.
My partner, he was brought in and he came and sat next to me. He was allowed to bring his camera in to take pictures for the baby when the baby was born, and it was just lovely because he could sit there and hold my hand. They put a drape up so I couldn't see anything really over the top. It was like a little tent, and that was across my partner as well, so he couldn't see over. I just remember feeling really excited, and I didn't feel scared. I just was really happy that I was going to see my baby soon.
It's normal to feel pressure, pulling, pushing, that kind of thing. Some people describe it like a rummaging type sensation. Your anaesthetist will be with you to reassure you if you need them to at any point during the operation. It's much more common to feel that rummaging sensation before the baby's born, which is usually within the first 5 or 10 minutes of the operation.
I remember them saying there might be some tugging, might feel some rummaging in my tummy, and they were reassuring me all the time if I was to feel sick at any point or anything felt strange, just to let them know. So I felt reassured because there was always somebody there with me.
So when the baby's born, it may go over to a resuscitaire, which is an area where there's heating and light for the midwives and sometimes the baby doctors to look at the baby to make sure that they're okay. Then once they're happy that the baby is okay and safe, they'll bring the baby over to have cuddles and skin to skin with mum. It's a bit awkward because you will be lying flat on your back, and it's very difficult to do any kind of feeding during theatre because of that reason, but cuddles are fine, and your partner can help you support your baby and cuddle them.
So baby was born and they took him away over to the side, and they did their checks on the to make sure he was breathing, everything was okay there. Rubbed baby down, wrapped him up in a towel, and let me cuddle him first before they weighed him. So it wasn't much of a delay between baby being born and having his checks and then being brought to me.
Once the baby's born, the operation takes a bit longer, but there's much less of the rummaging sensations there. Depending on your medical history and allergies, of course, we will sometimes advise that you have a pain-killing tablet put into your bottom at the end of the operation, and that works really well as the numbness starts to wear off. You're then written up for some regular tablets of painkillers and some other tablets and syrup that you can ask for if you need them afterwards. After a cesarean section, the epidural is left in usually for around 6 to 8 hours. After the cesarean, you go through to our observation area, which is a ward just next to delivery suite, where we keep an eye on all the ladies who have recently had operations. And the reason for leaving the epidural in is we can give further pain relief down the epidural, and that can be done on this ward. Once you are recovered enough, then the epidural is removed. Having the epidural removed is very straightforward and a painless procedure. Usually within 3 or 4 hours of you leaving the operating theatre, your legs will start to be able to use them again and start to gently walk around.
It was about an hour to 2 hours afterwards, and it was slowly, the feeling in my legs, that's what I remember coming back. It was like tingling feeling again, like when they put the injection in the first time. And then slowly, with time, there's a bit more discomfort in the tummy area where they'd done the cesarean section. And you could feel the tingling in the legs, and then I could start wiggling my toes and do a bit more there.
The first 24 hours, particularly after a cesarean section, can be quite uncomfortable. Most women cope really well on the tablets that we give them for pain relief. but it's important that once your numbness has worn off that you're able to get up and out of bed, just gently, and go to the toilet and that kind of thing. If you feel that you're unable to get out of bed because it's too painful, then you must ask for further pain relief from the midwives.
The pain relief that I was given was some morphine and paracetamol and a drug they said was called diclofenac, which is I think like ibuprofen or Nurofen. But it was the morphine that was they gave that to me to drink, and that was the medication that definitely helped with the pain. By the next morning I wasn't really needing any morphine or anything like that. I was just having the regular paracetamol and diclofenac. I was taking that regularly. And when I came home, I was probably still taking those for another few days, and then I stopped taking the diclofenac and then the paracetamol. So within a week, I would have thought that I had to take the painkillers for, really. The main discomfort was getting up out of bed to go and pick up the baby. That was the bit that was the hardest part, and that was the most uncomfortable part. Getting around, walking around, there wasn't any discomfort. I had no infections afterwards. The wounds healed up really nicely. The scars looking better every day. I had no after effects at all.
Most ladies who have cesareans here have a very positive experience. We are all very friendly. We will make you very welcome, answer any question, more than happy to answer any questions that you have, and look after you so you can meet your baby.